Today, though, we're talking everything you need to know about brachioplasty. So we're going to break down the procedure, recovery.
Brachioplasty is one of the most transformative surgeries we do. It also has some preloaded kind of thought process that people come in with. They're like, I would never do that. Like, it's kind of the common theme. Like, there's no way I would ever put a scar in my arm. And actually, after you talk to them about it and go through everything, which we're going to go through today, a lot of people say, oh, yeah, actually, I would do that.
Definitely not as common with men because men's skin has a lot more tensile ability to kind of bounce back. Even when a man is very overweight, it's rare that their arms carry a lot of that weight. Whereas with women, they can sometimes just carry a lot of heaviness in their arms. Basically, 3 options for brachioplasty is going to be your full, your mini, or your short incision, with potentially standalone of that armpit lift.
I got it. So a full brachioplasty covers the whole arm from your armpit to your elbow. The mini brachioplasty is going to cover the upper third of the arm at the most, if you're lucky. It's the upper part of the arm right before your armpit that dips down. And then you can also have an axillary extension through your armpit down to your chest wall. And that's for people with weight loss greater than 50 pounds, 60 pounds, something like that, where they come in, they have a lot of excess skin on that underneath the armpit, but what you would technically on a woman call a bra line. So
where do the incisions go? We kind of covered that a little bit with these, but I think the thing that people don't think about as much is even with a mini brachioplasty, mini, full, or axillary, you are going to have incision that is in your armpit. Then the incision is going to extend down the inside of your arm to and or just past your elbow. It's going to go somewhere along there, whether it goes all the way past, just past the elbow, or goes just a few inches past the armpit.
And actually, if you make a muscle and you can feel the groove between your triceps and your biceps, that line is where the scar would be. Yep. That scar with your arms down, it would not be seen. A mini brachioplasty is usually at a perpendicular angle to the scar that goes along the axis of your upper arm, like at the edge of your axillary hair or your armpit hair. Axilla just means armpit, and what it really should be is chest wall extension. That would be straight down from your armpit. The midline of your armpit would go straight down on your chest wall.
So who's a candidate for this procedure?
People that have excess skin and soft tissue of the proximal arm between the armpit and the elbow, or maybe that extends onto your chest wall.
Okay. Let's talk about alternative treatments and expectations.
Nice.
We actually talked about all of these, and these are non-excisional surgeries.
And that's a majority of the people that come in for contouring of their arms in our office are looking for this alternative approach. Now, if you have excess fat alone, but the skin quality is pretty good, by and large, we're probably going to push you toward liposuction with some sort of energy administration. But we prefer radiofrequency energy, which is body tight, which, by the way, we do in the office under local anesthesia, 45 minutes, and you're totally awake.
So if you are grabbing and pulling, technology can't do that. What technology can do is help bring something closer.
Body tight, best case scenario, maybe 20% improvement in skin tightening with fat removal. So the overall contour is, say, 30%, 40% better, maybe. Yeah. If you think about what I just said, maybe best case scenario, you're a great candidate for body tight, and maybe looking at a 50% improvement. I mean, is 50% okay? And if you do a brachioplasty, you can make it almost 100% better.
I think the bigger thing with all of these is to understand that the expectation, it cannot be that you're getting a brachioplasty from any of these procedures. The 2 questions everybody asks: will my scars be visible? Followed by, will everyone know? Will everyone know I had this done? There are definitely some things to think about. After a year, when that scar is fully matured, it is very rare that a scar is truly visible to most people who don't know it's there.
We've never had a patient come in and say, oh my God, this is the worst scar. This has ruined my life. All the things you would imagine feeling if you felt very uncomfortable and insecure.
So it actually makes it better. They feel better. Even they'll trade somebody seeing a small scar for the fact that they feel like their arm looks so much better. Their shirts fit better. Even if you're not wearing tank tops, like just having shirts that fit your arms, or not having skin that hangs over the top of your bra.
That's huge.
All right, let's talk about downtime and recovery. You will have drains. Your drains will be in anywhere from, I would say, 3 to 7 days in most cases. So if you can give your body a little bit of a boost in recovery those first few days by getting that fluid out without it having to do it itself, it does help. Range of motion, lifting, and driving are kind of lumped together in my mind because those are things that will be limited after surgery for quite some time.
So you got to really check yourself on range of motion, check yourself on activities. You have to be defensive for the first 2 to 3 weeks after surgery and protect your investment.
If you work an office job, you can be back to that job in probably 2 to 3 days. Once your drains come out, especially, you can be back to non-lifting, non-range of motion activities very quickly.
Right.
Let's look at some before and afters.
Let's go. This is someone who's had a brachioplasty with notable amount of weight loss, and actually more weight loss after the brachioplasty, which is why I like this picture.
Well, and this was an extended brachioplasty, and she'd had a breast lift.
But it's a pretty remarkable change, and most of that change is from the brachioplasty extended onto the chest wall. But when you've had 100-pound weight loss, 120-pound weight loss, this is part of post-bariatric cosmetic surgery.
So this patient has never been even mildly overweight in her entire life. She is, I would say, very thin, underweight. BMI is actually underweight. Like, she's not heavy.
But you can see with this, it's a 20-second video, and you can see when she rotates around, this gives you almost a three-dimensional view of what the arms look like. And also what's so great about this video is you can actually see the scars. This is fairly recent after the surgery, within a couple months. So you can see exactly where the scars are located. It is, as Amy said, a very well-tolerated procedure, but it's annoying as hell because your arms are bound up. You feel tight. You can't move it around. So you can't just do the surgery and be flippant about it afterwards. Overall, these patients are extremely happy with the results. We universally recommend it to our patients who are candidates without reservation.